Hey everyone, welcome back to another video. In this video, I'm going to be talking about nursing-initiated actions versus over-the-counter medication and talk about a controversial topic that I think would be interesting. So let's get started. If you're looking to improve your nursing knowledge or to gain more information about the nursing profession in general, please subscribe down below. I upload a video every single week and you don't want to miss them. Alright, so before I begin to talk about the topic of this video, I want to give you guys a bit of an update about what's going on with my channel. So behind the scenes, I'm working on a brand new website that specifically talks about NCLEX material. I'm creating this website in hopes to improve nursing knowledge, specifically strategies and clinical decision making that will help you in your practice, but also the NCLEX, if that kind of makes sense. So I'm gonna kind of review major topics and main diseases, interventions, and different strategies that you need to know going into the NCLEX. So I am working very hard on that, and it is taking up quite a bit of time because it is so comprehensive and I want to give you guys the best information I can. So it may take a little while until I am able to upload videos about the topics I talked about in my channel update, which is nurse economics, where I talk about my specialization in emergency and all these different things. They're going to take a bit of time because I'm really focused on providing that NCLEX review video, NCLEX review website that I'm working on. So with that being said, let's go ahead and start with the video topic. So in today's video, I want to talk about nursing-initiated actions and also talk about over-the-counter medications that you can find at a local pharmacy. So what I really want to touch on is the fact that we have to call the doctor for very basic medications. You know, a lot of times if a patient's in mild pain or is having, has chronic back pain and, the doctor hasn't had time to prescribe some sort of pain medication, pain management, we often require to call the doctor and ask them to prescribe acetaminophen, or if they're feeling nauseated, we have to ask the doctor to prescribe dimenhydrinate or Gravol. And to me, that kind of seems silly if you think about it. If we go to nursing school, and we have to practice taking all these exams, do pharmacology, learning about all these medications, learning about side effects, complications, all these different things, why is it that the healthcare field doesn't really trust nurses to be able to administer some of these basic medications when they see it's fit? So for example, a great example is the other day I was working and a patient required some melatonin to sleep better at night because, they went through a lot, they're at the hospital, the mattresses on the hospital are obviously not the most comfiest, so they required some melatonin, and I had to call the doctor at like 11 p.m. just to ask for some melatonin. And of course, the doctor isn't going to be too happy about that, even though it is technically their job. It's just an annoying thing that we have to kind of do. And it got me thinking about, why can't nurses do all these things? Now, there are some protocols that each hospitals have. Like, for example, in my hospital, I think you're allowed to give one acetaminophen pill, like 325 milligram of Tylenol, if the patient's in pain and you think it's necessary for them to get some sort of pain management and you're not able to contact the healthcare provider, you're allowed to give them acetaminophen. But it just seems so silly because, the patient can easily go on a day pass, for example, or just go to the local pharmacy at like Save on Foods or local drugstore or whatever and grab some Tylenol that's higher dosage. They can grab like naproxen, they can grab Advil, they can grab all these different medications, Gravol, that we can't really give. So it just seems a bit strange that nurses, even though they're in a position where they're allowed to give PRN medication when they see fit, they're not allowed to give some of the over-the-counter medications where it could be quite therapeutic for the patients. Now, I know a lot of different, like I mentioned before, a lot of hospitals have different protocols and different nursing initiated actions is what they call it in my hospital. And a lot of hospitals can prescribe certain medications, based on their protocols, of course. I'm curious to know what your hospital allows you to give as a nurse, and if you guys have any similar things like that. Now, of course, if you work in a specialty field like labor and delivery, or for example, I sometimes float over to the cardiac ward, and we do have chest pain protocol, which, we just check their blood pressure, give them nitroglycerin spray, recheck their blood pressure, get an ECG, get a troponin, maybe administer some morphine. We're allowed to do all that based on the chest pain protocol on the cardiac ward. But I'm talking other floors, like if you're on a neuro floor, if you're on a rehab floor, if you're on like a medical floor, post-op floor, you can't really do that. You have to kind of call the doctor and say, hey, I think this patient should require this and that. Or like the patient can't sleep, I need some sleeping aid to help them out. And it just seems a little bit silly to me. But I'm curious as to what are the protocols in your hospital, as I know it kind of changes speaking to kind of my nursing students who, my nursing colleague, that some of my nursing friends that I went to nursing school with, they also mentioned that they have different protocols at different hospitals, and it's a bit bizarre to me that some hospitals trust nurses to do other things and other hospitals don't trust them to do other things. It just seems a bit strange. So with that being said, I hope you enjoyed this video. Let me know about what your hospital has available for you to prescribe or to give medications based on protocol. I would love to hear what your hospital has. And let me know in the comments below if you thought this video was interesting. Give this video a thumbs up, and I'll see you in the next video. Thanks for watching.